Coming to 12 minutes past 7 today sees the latest stage of a major overhaul of the welfare system as tougher tests are introduced for new claimants of disability benefits in England, Scotland and Wales.
Well, ministers say that the move towards personal independence payments will modernise and simplify the system. Campaigners, though, say many people with disabilities could lose their independence in the process. Joining us now, campaigner Kalia Franklin, who receives disability living allowance herself. And we can also speak to Stephen Duckworth from Capita, one of the companies which will assess the new payments, who is in our central London studio. Very good morning to you both. I wonder whether we can start with you then, Stephen. The system is supposed to be simplified because it is too complex at the moment. How will it change for people in receipt of disability living allowance?
Well, at the moment, most people receiving disability living allowance aren't actually assessed by a health professional. So moving forwards with the introduction of PIP, all individuals will have the opportunity to be assessed directly by a health professional who's suitably qualified to undertake these assessments.
OK, so that's one of the changes. Kalia, you receive disability living allowance. Your assessment will now be done by somebody with medical qualifications.
Well, I think...
Is that going to help?
No, I don't think it is, because people like me who I've been assessed on a form over the last 10 years, but the assessment the benefit would never have been granted if that form hadn't been backed up by evidence from my GP, from a professor in rheumatology, a physiotherapist.
What is your disability, if you don't mind me asking?
I have a condition called Ehlers-Danlos syndrome, so my joints dislocate very frequently and unreliably, so it's very painful and tiring and makes life an interesting challenge.
And you have difficulty in walking. Presumably you're sitting like this because presumably that's
yes,
the only comfortable way to
because my
be.
feet don't reach the floor and my hips will pull out of the socket, so I'm sort of pushing myself back up like this.
Under the new assessment methods, would there be any difference to the way that you are sort of either treated or the benefit that you receive?
I'm not sure there will be for people like me who are more severely disabled. I think that by changing some of the criteria that we're assessed against, it's going to be more difficult, because although governments and administrators like to talk about making things less complicated, disability and people by their very nature are unique and complicated.
Can you give us a specific example of one of the criteria that you think is going to make it harder for some people?
I think the change to the distance of a qualifying distance for mobility of 20 metres is going to make it difficult for a lot of people. OK,
so before you had to prove that you couldn't walk 50 metres, now yes, you have to prove that you can't walk more than 20
yes,
metres, is that right?
And if you can walk between 20 and 50 metres but you can't do it reliably and safely, then some judgment will be assessed, so you should theoretically get the benefit. But disabled people were actually quite clear in their understanding of how disability living allowance operated and how it applied to us. So we weren't necessarily seeking that kind of clarification.
Right. Stephen, Dame Tanni Grey-Thompson has been very critical of the new system. As you may have heard yesterday, she said that disabled people would be ghettoised by the changes, which risk turning back the clock 30 years.
Yeah, I think there's some unnecessary concern really in relation to the interpretation of what's actually going to happen. I think that it's clear, you need to be clear to understand that over the next 2.5 years, the majority of people who will be assessed for PIP will be new to their impairment, new to their disability, and many of them will tend to understate the experience of their condition. So they will submit a form, as has previously been the case, along with further medical evidence from their general practitioner or indeed their treating consultant, and our health professionals will be able to look at that information. Yes, and decide whether an individual needs a face-to-face assessment.
What do you say to the criticism, but the charge by Dame Tanni, though, that it is ghettoising disabled people?
Well, I can't understand really what is meant by ghettoising disabled people in terms of the way that the benefit will be applied. For me, personal independence payment is a payment that's directed at funding the additional costs, and it's clear from what the DWP have been saying that over the next 2 years the funding for that benefit will increase in real terms.
Well, charities say that around, well, more than 500,000 people could lose out on money as a result of these changes, money which helps them get around, which means that they face being restricted to their homes. Are you seeing figures like that in your calculations?
Well, the estimations that have been made are predictive of what might happen in 2.5 years' time, and you know, unfortunately, I'm not able to look 2.5 years into the future, but certainly anyone who's currently in receipt of disability living allowance at the moment will be assessed for 2.5 years.
Kalia, one last thought from you. What are your thoughts on that?
I think it's really important to say that there's 600,000 people who will become no longer entitled or not qualify. That's the government's figure, because when they announced the new personal independence payment, the government were very clear that this was about reducing by 20% the overall caseload. And I think the problem is going to be particularly for people with mild to moderate disability, perhaps learning disability, and that small amount of money that they would have received is what keeps them involved in the community. But as we're seeing social care cut back a lot and we're losing a lot of community services as a result of austerity, it's a triple whammy really for those people with those needs.
All right, Kalia, thank you very much. Stephen Duckworth, our thanks to you as well. Thank you both.
Thank you both very much indeed, and we will be speaking to the Minister for Disabled People, Esther McVey, after 8 o'clock this morning, putting some of those points to her.